One of the aspects of your work that I find really important is about this concept of a system, right? And the idea that the system around us, which is those pieces of things that we can't necessarily account for or control, that system has been rigged, right? Which is a really, really powerful frame because then it opens up the question of for what and by whom, right? And I think there's some really interesting ways that gets played with, and we're seeing that in particular, to do some pretty terrible rigging. I would argue at the federal level by Doge and Musk. You guys have done some thinking about this and actually wrote about how Musk is leveraging the idea of the system being rigged to, in fact, rig the system. Can you share a little bit more about why that is such a powerful frame and about how it's getting used right now?
Yeah, I mean, I could talk a lot about system as rigged thinking. It has emerged as an incredibly powerful mindset in the work that we've been doing, Abdul. So we've been monitoring, tracking mindsets, kind of deep, implicit, shared understandings that people use to make sense of complex social issues in a project called the Culture Change Project since May 2020. And I would say like the most remarkable finding from that project is the degree to which we have seen the strength of system as rigged thinking increase. And when I say strength, I mean both the way in which this mindset is at the front of people's thinking has increased, right? It is the dominant way that people make sense of social issues in today's world. And also its scope. So when we started the work, system as rigged thinking was kind of restricted to people's thinking about the political or the economic system, but we have seen that dramatically expand, and people evoke system as rigged thinking to talk about health or education or reproductive rights or kind of whatever the issue that you put in front of them. The explanation for the problem is that the system is rigged. And there is, it's a fairly simple script as a mindset, and it goes something like this. There are a few people in power who have control over the system. They use that power to manipulate it for their advantage and to the disadvantage of everybody else. That's the script. Now, here is the problem. You can probably hear in that script, it is incredibly vague and full of holes. You can fill that mindset in a way that leads to replacement theory, that leads to xenophobia, reactionary thinking, and racism. You can fill that same mindset in a way that leads to a really kind of progressive critique of the concentration of power, something that looks like kind of, Occupy or 98%, whatever it is. So that same mindset, when filled in different ways, leads to dramatically different perspectives. So our question for the last 2 years has been, how do we fill it in a way that consistently leads to that more productive critique of how systems are being manipulated to advance inequities and concentrate power in unproductive ways. And I won't get into this right now unless you're interested, we've found that there are some ways of doing that. Like there are some ways of telling these system as rigged stories that consistently avoid the kind of xenophobia and racist tendencies that narrative can have, and direct it in like with some pretty good integrity. And by integrity, I mean kind of resistance to being co-opted in these more productive directions that can help people think about what is going on in our country right now. And importantly, what needs to happen, right? I think that is a key part of the narrative. So system as rigged thinking is, we've come to the perspective, like it is here to stay. And if we are not thinking about how to effectively engage that, to mobilize and motivate the kind of actions and solutions that we're interested in, we are seeding this incredibly, potentially like the most powerful cultural narrative of our time, right? And so we've come to the conclusion that moving away and avoiding it is really not an option.
Yeah, use it or lose it. And by it, I mean democracy. So I think it's one that we've all got to get really fluent in using and using effectively, really fast. And doing that in ways that, again, like are not I'm not talking about appeasing anyone, but I do think it's important that we're careful not to continue to fuel polarization. And so working on doing that, talking about the system is rigged in ways that can reach the persuadable middle of America, which is vaster and more persuadable than our political discourse might lead us to believe.
Yeah, and I should mention I know this work because I sit on the advisory board with you all and thinking about specifically how to engage with this narrative that's so dominant through the Culture Change Project. And we're in this moment where I think a lot of us who see value in a lot of the government infrastructure, even if at times it could be so much more efficient and so much more effective, we see value in those institutions. And when folks who have been rigging the system for a long time, like billionaires who have literally taken handouts from the government for years to build their companies, are actually rigging the system, they're very good at weaponizing that narrative. And you're seeing it seep in across all the different facets of our government right now under this administration. In one particular space, the one we pay attention to on the show, you think about Health and Human Services. We've got a secretary who literally has made a name for himself as being the system is rigged guy around vaccines in the context of a measles outbreak that is infected hundreds of people now and literally crossed state borders and international lines. And he's leveraging his position to drive vaccine hesitancy in the way that he continues to emphasize this idea that because these vaccines were vetted by a system you can't trust, that you should be careful and you should make decisions for yourself. Meanwhile, a lot of us on the other side are defending a system, right, that hasn't been perfect, but also are trying to defend it from being destroyed, which puts us very much on the wrong side of that narrative. And so I want to ask you, as we try and engage with this moment, how do we counter this when they've so very clearly articulated themselves on the side of this? How would you recommend engaging with this frame in a way that's a little bit more productive when in fact we are asking people to do the thing that, millions of dollars and millions of hours of time have spent to produce these like pretty miraculous things of these vaccines, and is way easier to demagogue them than it is to get people to take them. So what's your recommendation to all of us who are trying to take this issue on?
Yeah, I think one thing we can try is to talk about the various checks and balances, the stops along the way to a vaccine recommendation as protections we've put in place so that, right, the system is safe and fair and accessible to everyone and not rigged. I thought a little bit more about this on Medicaid than vaccination. So talking about Medicaid as a way we actually tried to unrig the system, Medicaid expansion in particular, right? It's the way we offer public health insurance when people can't get private insurance from an employer, either because they're unable to work due to disability or illness, or because they're actually working 3 jobs and those companies are not giving health benefits. And so we came together with our collective power to give more Americans access to coverage. And 8 of 10 people enrolled in Medicaid rate it highly. And of course, there's always room to improve any system, but we can't improve a system that doesn't exist. And we can't trust the private markets, right, to make sure we all get taken care of. And so, cutting or ending Medicaid would be knocking down, right, one of those load-bearing beams in the foundation of our community health and a structure we actually built to protect people, right, from an unfair, privatized, profit-based system. So that's one example I think that we can try. We'll be going, to test that specific work on health pretty soon. So stay tuned. But engaging with that narrative, I think not just pointing out billionaire villains. The research we've got on that is interesting. It can do some good things. It can also keep the story pretty narrow on in personal individuals and obscure the bigger view of what's happening. But those are some thoughts.
One of the things that's really interesting to me about public health is that generally we have embraced our role as the system to much damage. And because if you go back to the big fights that public health has taken on, we were always the folks trying to expose the system as being rigged. So like go to the swill milk epidemic of the early 1900s, right? Late 1800s, early 1900s. And our whole point was, hey, the system is rigged. They're not feeding you milk. They're literally feeding you chemicals as milk. Or you can fast forward and and go to the huge fight that public health took on against big tobacco. Hey, they're selling you these things, telling you that these are good for you and that doctors smoke this, but doctors actually know that this is really harmful. And we're going to take down one of the biggest industries in America because they're hurting you. And I worry that we as a sector, as a group, have gotten comfortable as institutionalists and forgotten that our job is to pick big fights with the folks that are hurting people. So I've been calling for a minute now for a big fight with big tech, right? That is a really powerful institution that is literally fracking our minds for our attention, taking us away from the people we love most, away from our communities and away from ourselves. And this is a fight that we should take on because they're trying to rig the system against us. And the problem is that we've almost lost that will because we're so focused on the small marginalia that we've been told is our actual approach. Similarly with big healthcare, right? Healthcare was never supposed to be about padding the pockets of huge corporations. It was always supposed to be about keeping you healthy when you got sick. And now, right, you get your pay garnished and then have to pay $4,000 to get the healthcare you thought you already paid for because you got sick. Like, these are fights we should pick. And I wonder, as you sort of think about the melding of attention and policy in the way that politics naturally has done, but like done in real time now, given how fast information moves. I'm wondering what your recommendations might be to our field as we think about trying to leverage this moment and the conversation that's being had about us around where to go from here as a strategy.
It's a great question. It's a huge question. It's a hard question. Next question is kind of what I want to say. But I think we do know. I think we have some ideas about how to do that, Abdul. And I just want to take a step back and say, like, there is a tension and a paradox in what you're saying. It's like, how do you critique systems, but have those same systems be part of the solution? Like, and it's bigger than public health, Abdul. It's like, I would say it's like the progressive paradox. Like, how do you be critical of the thing that's an essential part of moving forward and solving problems? And I think there's like some steps to think about. And I think the first is to be really clear about what we need from these systems. Like, what do people need from these systems? What do they do? What unique role do these systems play that other systems that might fill in for them can't do? Right? Why are these things essential? And then move pretty quickly to an explanation of how weakening them or eradicating them creates problems, right? It means that they can't do the things that we need them to do for us, and that there are problems that we experience as a result. I do think it is important in these stories that we tell and these narratives that we advance, that there is some recognition that these systems are not working as they need to be working. And I think without that acknowledgement, we turn off and we turn away a lot of people. I do think it's possible to acknowledge the fact that the systems matter and are an important part of the solution, yet have not been working in the way that we need them to work. And then to follow that with some really concrete explanation and particularly examples of how they need to change to do their work for us better. And the more we can get specific and provide examples, whether they're historical or from other issues, that illustrate that that is possible, combats one of the biggest backfire effects when we talk about systems, is that people may understand a problem as a system, but as soon as they do, their understandings of systems as opaque and intractable make them wildly and completely fatalistic. So you may have put a problem in a system, but you've made it totally out of reach and people see it as something you can't address. And the antidote for that is examples that show efficacy, that we can make changes. Here's what they look like. Here's some places where they've happened. And here's what happens as a result when we do the things that we know we need to do.